Coming to you from the car before my gym workout, dressed in a sweatshirt and sweatpants so that I sweat a lot, but I'll be sure to replenish my magnesium levels after to make sure I don't get hypomagnesemia. And you know what that means. It's Web Wellness Nerd Out time! What's going on, guys? Happy When Wellness Nerd Out time. And today, we're going to be continuing our discussion on magnesium. A super important mineral. Again, it's essential. We need to get it from the diet. But aside from continuing to talk about magnesium, I want to say a very, very happy birthday to Anthony Zahor. Happy birthday, brother. I hope you are having a fantastic day today. I'm sure you're hitting the gym as well. You absolute shredded up beast. You're a great guy. We'll talk about him more at the end. But as for now, let's get into our discussion for the day. So, to kind of pick up where we left off yesterday, well, we were talking about magnesium, and we talked about how, if somebody had low levels of magnesium, that they could have neural hyperactivity, that they could have decreased insulin sensitivity, which is not good, right? That they could have higher blood pressure, right? And things like that, maybe anxiety if they don't have enough, because magnesium has this sedative effect, right? That majorly, and so again, it's been shown to be good for people with ADHD, good for people suffering from depression, people with high blood pressure, as it would lower it, right? And it's good for increasing or improving your insulin sensitivity. And we talked about some food sources, spinach and pumpkin and squash seeds being among the highest, right, at 157 and 156 milligrams respectively with those two sources. That's for a cup of cooked spinach, by the way, and 1 ounce of the seeds, the pumpkin or squash seeds. And with our daily value being 200 to 400, right? So that's pretty high. But today, what we're going to talk about, I pretty much just summed the whole one up yesterday. If you didn't see it, there you go. You just saw it. But we're going to focus on magnesium's role in bone health today and what can happen if we are deficient and we have hypomagnesemia or low levels of magnesium in the blood. Because if we break down hypomagnesemia, hypo, low, right? Magnesium, and emia just means blood. So we always break it down at When Wellness. If you're not familiar with medical terminology or anything, things like that, everything should be fully transparent and comprehensible. I'm not saying that I would think it wouldn't be to anyone, but we might as well talk about it, and we always say the roots of things. And when we talk about magnesium and bone health, well, hypomagnesemia, as we just said, which is low levels of magnesium in the blood, has been associated with a decrease in bone mineral density, or we could say, increases your chances for bone loss. And, this is because, like calcium, magnesium is an essential mineral component of bone. All right? Now, all the same, higher levels of magnesium in the blood is associated with an increase in bone mineral density, right? Or bone strengthening. So, it goes both ways. Now, what would be a few demographics that might be at risk, say, for hypomagnesemia or low levels in the blood, right? Well, number one, the elderly. And, this being because maybe they're, albeit they might not be getting enough magnesium from food sources, like some of the aforementioned ones, they're also are the elderly, the geriatric population, isn't able to absorb magnesium as well as the more youthful demographics. And so they're at a higher risk for having lower levels of magnesium, and we know that decreases in bone mineral density, a lot of comes on with age and all sorts of conditions, and we talk about osteoporosis all the time on here. And so not only is it important to supplement with calcium and vitamin D for increasing that bone mineral density, but also magnesium. It should not be overlooked, right? Not to mention it's got a whole lot of other benefits, so bada bing, bada boom. It's just another reason. Another demographic that is at a risk for low levels of magnesium in the blood or magnesium deficiency are athletes. And as healthy as athletes are, as great as it is that we're doing high intensity exercise all the time, well, frequently doing high intensity exercise albeit it cuts your chances for getting a cold in half, which is a great fun fact about high-intensity exercise. That's right. Cuts them in half, your chances of getting a cold. You're sweating a lot. And when you're sweating a lot, you're losing not only water, but essential minerals like magnesium. And this is especially prevalent or we should say important, right, for the demographic of people that do high-intensity exercise and participate in sports that require weight control. I say it twice because, think about this, like a wrestler that's trying to make weight. You got to really make sure you're replenishing your magnesium levels, taking some sort of electrolyte supplement or something, or eating magnesium-rich foods, number one, always with food, over supplementation. I think there was one exception here at When Wellness. But, number one, get it from food. But this is because, one, you're sweating it out. Two, if you're trying to cut weight, what are you doing? You're not eating as much. You're not eating as many magnesium-rich foods. I think it's a little crooked. So, you're getting the double whammy here. You're at an increased risk for, just losing a lot of it, and you're not getting it. So make sure, especially if you're in a sport, again, that deals with weight control, you get a lot of magnesium. All right. So who do we talk about? Elderly, athletes. Yeah, you won't believe the third one. Type 2 diabetes mellitus patients. Now, obviously, I feel for anybody that has it, and it's a terrible disease, a whole world of complications. But the reason I say it like that is because here's yet another one. People with type 2 diabetes mellitus, it's been shown, are 35% more likely to have hypomagnesemia than the average healthy adult in a developed country. And the way, that's not how it was written in the study I was reading, but it was written as, the average healthy adult in a developed country, out of all average healthy adult age demographic ranges, 15% have low levels of magnesium in the blood. 50% of type 2 diabetes mellitus patients have low levels of magnesium. So, that's another one to add to the list for diabetes. But this is something I want to talk about for a second, because what did we say is something that magnesium can do? It can improve insulin sensitivity. So this is no bueno. If you're diabetic and you're not getting enough magnesium, not only is your insulin sensitivity lower, but now you're not getting enough magnesium, you're at a higher risk, even more so, again, for having lower insulin sensitivity, and when it rains, it pours, So, if you or a loved one has type 2 diabetes, please make sure that you or them are getting plenty of magnesium in the diet, right, from your diet. And if you need to get it from supplementation. Now, what are some other things that could cause low levels of magnesium or deficiency? Diuretics. Diuretics are one. You're excreting a lot of it through urine, right? What else do we got? Proton pump inhibitors was one, and antifungal medications such as amphotericin B, that's what it was, is another possible thing that could cause, low magnesium levels. And so, again, proton pump inhibitors, antifungals like amphotericin B, or if you take diuretics, you're also at a higher risk for having too low levels of magnesium in the blood. All right. Now, having said that, we talked about some forms yesterday, right? And two that we talked about when we talked about loading with magnesium was magnesium gluconate and magnesium diglycinate. And we said gluconate and diglycinate if you were going to superload. And, the reason I mention it now is because we just talked about all these different ways you could have low levels. So you talk to your doctor first. This isn't a recommendation to superload per se, even if you have any of these conditions, but you talk to your doctor. And if you do decide to superload, well, again, gluconate and diglycinate are two recommended forms of magnesium to take. Now, gluconate especially, and when we talk about magnesium gluconate, it should be taken with food to maximize and increase its absorption, or bioavailability, we could say, which isn't that low, but we might as well increase the bioavailability, right? We'll talk about one form that has terrible bioavailability, but definitely take it with food. As for other forms of magnesium, you can have them on an empty stomach and you should be just fine, all right? Now, we talked about yesterday magnesium chloride and magnesium oxide being two forms of magnesium that could have these negative side effects of GI distress and diarrhea and things like that. And one especially you should probably stay away from, or at least it's recommended, and it's probably at the lowest level, is magnesium oxide. And it's not just because you have a high chance of getting these adverse side effects, but also because it has such a poor bioavailability. Does magnesium oxide. One study done on mice showed that the mice taking magnesium oxide were only absorbing 15% of it. Another study I was looking at on humans showed they were only absorbing 4% of them, 4% of the magnesium oxide they were taking. So, you're telling us all these bad ones. What's the best? Well, aside from, gluconate being recommended for loading, especially, magnesium citrate is a good form to take in general, apparently, at least as far as research goes. All right. Now, having said that, if you do have hypomagnesemia, or you have any of the symptoms we were talking about that could come along with it, or if you're looking for that decreased anxiety or that sedative effect, right, that decreased stress, because if you're taking magnesium, generally you'd want it during the nighttime before bed, because again, it does have that sedative, that very calming, relaxing effect. Then you should, again, if you're deficient, or whatever the reason is, you should get it from food. You should get your magnesium from healthy food sources first. You only supplement with it if you absolutely can't get it through the diet. All right? But you do your best to eat your cup of cooked spinach every day. You do your best to have an ounce handful of those pumpkin seed squash seeds, that tuna, that avocado, those bananas, right? Things like that we talked about yesterday. So, having said that, thank you very much. That was a good discussion. I'm going to get a good workout now. Usually I do it after the workout, but I had fun doing it with you guys before. I had to park away from everybody, so, we don't disturb anyone, but it went great. I do want to say before we go, happy birthday, Anthony Zahor. Happy birthday, my brother. I hope you're having an awesome day, dude. And, when I think of you, again, if you haven't seen this type of thing before here at When Wellness, we always speak from the heart and off the top of our head. And when I think of you, I think of seeing you. I think of meeting you for the first time, seeing your face, and it's just lit up. Such a happy, just such a positive energy and presence to you. And you must just have an innate love for life that, I'm very happy to see in anybody, but it's fantastic. It's absolutely fantastic. And, never stop having it, and, maintain that excitement for life throughout your entire life. And when I think of Anthony also, chiropractor, pie guy, victory brother, always, you are going to do great things. You're always going to do great things because your attitude, you're a hard worker. You're a hard worker. You don't need to know Anthony Zahor that well to know it. You just need to look at him. You can tell a lot by looking at someone. You don't judge a book by its cover. But especially good qualities, you could tell, a lot by looking at someone. The proof's in the pudding. Does he work hard? Guy's in great shape. You're killing it. And never become satisfied. Never become satisfied. Anybody that loves you would tell you that. You keep getting better, but be happy with where you're at because you're doing a great job. And you know, I hope I get to see you soon, brother. Maybe when I'm out there visiting or something like that. And you know, I want you to know 100%, 100,000%, this one is absolutely for you. So, happy birthday and happy When Wellness, people. Who do we got on here? Let's say hi to the people. Big Boy Cheese, what's going on? How you doing? Sajid, NJ, what's going on? Thank you for hopping on. Alessandra Cortez, what's up? Flip the Switch, Bertha Flores, the OG. And Dominique, what's up, girl? How you doing? Thank you for tuning in. Have a fantastic rest of your day. I'm about to go get in a fantastic workout, and we'll see you tomorrow, folks. Happy When Wellness. Thank you.